It's 027-1035 WICY, your feel-good favorites from the 80s and more. John Kazar. And joining me again on behalf of Hyde Medical Center is a primary care physician and Hyde's physician leader for the UVMHN Medical Group as well. Dr. Dragos Banu, how are you?
John, I'm very well. Good to be here again.
We had a great conversation last week. I felt like it got cut a little short because there was so much more we had to talk about, so we decided to have you back on again to finish things off, and there's a lot to talk about.
Sounds good.
Yeah, we're going to start off with this variant. What are the COVID-19 variants and why all the hype about them?
Again, another good question, John. So a lot of questions that we get in primary care, and I want to be able to communicate to the audience is, the new variants that we hear a lot about. There's some of them. There's the Brazilian variant. There's the UK variant, and really what they mean is they're just more sticky in a way. Mm-hmm. So, they have a higher rate of infectivity, and specifically some of them, like the UK, the most recent data also tells us that it has a higher death rate as well. And an easy way that helps me and helps the rest of us understand, imagine as if you're reading a piece of paper and you're sort of asked to memorize that piece of paper and then write it again. Mm-hmm. So as much as times as you do that, you're going to miss a word here, a word there. And that's what these variants do. By allowing them to basically do their job, meaning infect people, the virus changes. There's words or genetic material that get altered, and then the virus becomes more sticky. So the more the virus replicates, the higher the chance it becomes of becoming one of these variants and becoming more sticky, more infectious, that sort of thing. So which brings us back to the original thought, the faster we vaccinate, we don't give the variants a chance to replicate. And then we don't give the variants a chance to be. And to be more infectious and deadly. So, again, it ties in, with the whole, let's, kind of vaccinate as much as we can and as fast as we can so we abolish these variants. And I think the bigger question that I get a lot, and you may hear of this as well, is, am I protected against these new variants that are, more infectious and more, deadly with the vaccines on the market right now?
Okay.
And the answer is yes. So, most of this we have 3 vaccines which do their job. There may be, a couple of fold less of protection. We don't know. Maybe from 95%, it's a 90%. Maybe from, 80, it's an 85%. But it's still very protective. Our vaccines, the Pfizer, the Moderna, and the Johnson & Johnson, they still help and they still do the job, so to speak. So my message is don't allow the vaccine the chance to replicate and to change and to mutate. Therefore, you vaccinate.
Yeah, what side effects can someone expect when it comes to this stuff?
The side effects are most of us have gotten a vaccine throughout our lives. So, there's a redness, there's a tenderness at the site. There's a little bit of tiredness, fatigue, that sort of thing. But again, in my opinion, much better than getting COVID.
Yeah, that's and this tiredness is just like it's temporary, like extremely temporary for a lot of people.
Absolutely, and I can tell you what I felt. So when I got my vaccine, and my wife as well, we felt great, on day 1, and then day 2 and 3, we sort of, felt tired. Just that's the best way I can explain it. And then by the end of day 3, we were all set and we were back to our normal.
Yeah. So is it acceptable to drink alcohol between doses?
Another good question. Yeah, I think if you're the kind of person who likes to have a little bit of wine and cheese, at the end of the day, that sort of thing, it's totally appropriate. As long as you're having one glass of wine, it's not going to hurt in between doses.
There seems to be new data on pregnant women. You want to share that with us?
Yeah. So I want to say sometime last week, very limited information, but good information is coming. And it allows us to see that once pregnant women are vaccinated, they actually transmit the immunity to the fetus, which is data that we just didn't know. There's much more to come. And I think, people are working very hard on that sort of data. But we now know that the immunity is transmitted to the mother, from the mother to the fetus, which is great news.
Awesome. Yeah, I got lucky with that one, huh? That it worked out.
Yes.
Yeah. I got two more quick questions, Doctor. How long does the immunity last?
So the immunity. So I'm going to go to the newest data we have from Pfizer, which is an mRNA vaccine like Moderna, and the people who have enrolled in that trial. All of this is this trial is new, so there is evidence that 6 months into the trial, and those people are still being monitored, but they still have up to 92% of immunity. They may, that may mean, they're getting tested continuously, but that may mean, a year from now, they'll still have maybe 3 years, 5 years, who knows? But at this point in time, what we know is that 6 months later, after the second dose, the people in the Pfizer trial still have immunity, which is great.
It is primary care physician with Hyde Medical Center, Dr. Dragos Banu, with us for a second week in a row. We had so much to talk about. We completed it, I think, for now, until new information maybe comes out in a few weeks, right?
Sounds good, John. Thanks for having me.
Take care. It's 1027, 1035 WICY. We get updates out of Hyde Medical Center Wednesdays, 9:40, right here.